Hi. For my project today, I will be teaching you guys about cataracts. My project will be covering cataracts as functions, the physiology, treatments, symptoms, and an interview with someone who had them. On this screen, you can see that there is a diagram in the bottom right-hand corner. This is the anatomy of the eye. Cataracts form on the lens of the eye, which is located on the left side of this picture, and it's right near the iris and the pupil. First, I will be talking about early history, discovery, and overall what a cataract is. The word cataract stems from the Latin word waterfall, and it's named after the word waterfall because waterfalls have that white rushing water, and cataracts form a white cloudy spot on top of the lens of the eye. Cataracts are a buildup of proteins, and they can develop in one of your eye or both of your eyes. Cataracts inevitably lead to the deterioration of eyesight, and they do this by blocking the light from getting through the lens of your eye. They can grow in size or multiply in number, and they can oftentimes result in blurry or cloudy vision. The first cataract that was documented was in around 2457 BC. It was found in Egypt, and it was actually carved on a wood sculpture, the one on the right. And as you can see, the eyes have that cloudy whiteness on them, and that was the first depiction of cataracts on humans. The first true extraction of a cataract was done in 1747 in Paris, and this was profound because it had a 50% success rate opposed to couching, which was the first form of cataract extraction. Couching was or is, it's still practiced in some countries, but couching is a very aggressive hit to the lens. The goal is to dislocate the lens and dislodge it from the eye so that you can pull it out with a needle. Due to the violent nature of this procedure, it's traumatic on the eye and often results in blindness or vision impairment. So the new form of extraction in 1747 really changed the medical field for the better. Next, I am going to teach you guys about the different types of cataracts. So in this picture, you can see the 3 stages of cataract formation. You start with a normal lens, clear, easy to see through. You don't have any blurriness or foggy sight. And progressively, as the cataract begins to grow or multiply, it turns into an immature cataract. So you're going to have maybe slight symptoms that I will be covering later, or slight cloudiness of your vision. And the last is a fully formed mature cataract. This will cover the full lens, and you'll be able to see just the iris surrounding it. So the 4 types of cataracts. The first is age-related. This is the most common type of cataract that forms and is extremely common throughout the US, the world, and it affects both of your eyes or one of your eyes. The next is congenial. They usually don't affect your eyesight if you form this type, and it's usually seen in babies that are born with them or early childhood, youth, early years. The third is secondary cataracts. These form when you have a pre-existing disease in your body. So an example of this could be diabetes. And I will be talking about this later, but diabetes can lead to the formation of cataracts. And that type of cataract formed would be classified as a secondary. Another thing that can lead to secondary cataracts is the use of steroid use. If you periodically use steroids, you can begin to form this as well. And the fourth type is traumatic. A traumatic cataract can form right after an accident, whether it be a car accident or a head injury, an eye injury. It can happen right after, months after, or even years after. It just depends how that cataract develops, at what rate. Now I will be talking about the causes of cataracts. There are multiple types of causes. These are the four most prevalent and commonly seen, not in any particular order, just the most common. The first being diabetes. So people with diabetes have an increase in high blood glucose levels, and these high blood glucose can result in your blood vessels in the retinal eye being damaged. Drinking too much alcohol. So this actually begins in your liver. Your liver can produce a harmful enzyme called enzyme cytochrome. And once this enzyme is produced, it can lead to the catabolization of proteins in your lens. And once they get clumped, they lead to that cloudy cataract. The third is spending lots of time in the sun. If you're exposed to a lot of UV light directly on your retina, then this would dramatically increase your chance of contracting or growing a cataract. And this is due to harmful oxidative reactions that happen within your eye, but I'll cover that further. And the fourth is age. So age increases at the same rate that your cataract would. So the older you get, the higher your chances are of getting a cataract and growing them. Again, they are extremely common. Now I'm going to be talking about the symptoms of a cataract. All people will experience physical symptoms surrounding their cataracts. So these would be blurred vision. That is definitely the most significant one, and probably the first one that people will start to notice due to the opaqueness of the cataract formation. And in this picture to the right, you can see blurred vision. So maybe it might seem cloudy, smoky, foggy. You can experience difficulty with vision at night. So this could either be things are not as sharp, not as clear, or too dim. The third is light sensitivity. So this could also connect to UV light exposure. If you are sensitive to light, it could be sun, you have to keep your blinds closed, dim lights in your home. Any signs of new light sensitivity, you should definitely contact a doctor. Double vision, anything that you're seeing 2 of, 3 of. Fading color, this could be fading of any color or the yellowing of colors. And the need for a bright light while you're reading. This definitely is a sign of a cataract. All of these symptoms will begin to form around 40 to 50 years of age and increase as you increase in age. This is because your proteins will begin to thicken as well. Physiology of your symptoms. Blurry vision being the most common symptom of a cataract. As you can see in that picture to the left, the cataract covers the whole lens, and you can clearly see how it's cloudy and white and how your vision would be significantly impaired. This is caused by when your proteins thicken, they want to clump together. And when they clump together, it can lead to blocking your whole lens and really just decreasing your vision. Diabetes can cause vasoconstriction of blood vessels along with the death of blood vessels. So that picture in the bottom left shows the blood vessels vasoconstricting and not allowing the proteins to move freely and forcing them to stick together, clump, and create that cataract on the lens. The third is light sensitivity. So excessive exposure to light, giving you light sensitivity, can lead to glycation, which is the presence of excessive glucose, resulting in protein buildup and a cataract. Now I am going to be talking about the treatments for a cataract. So cataracts do have a treatment plan and a cure, I guess. They may come back. It's not common, but cataracts can just grow with age. It's not due to any other reason. They just are a common thing with aging or other factors that I had mentioned. So cataract surgery. There are two different types that are very common. The first being the most popular, phacoemulsification. This is the picture on the right, the top right. It involves a small incision being made into the lens of your eye, and that purple stick is a wand that they use to break up the proteins with sound waves. These sound waves break it all up and allow the surgeon to pull out the lens and clean it out so that they can put a brand new one in. The second type of surgery is extracapsular surgery. And this one involves a larger incision being made on the eye. And they begin pulling the hard lens out the center by one piece and then suction out the remaining and replace it with a new one, just as they did with the first one. The pros to these involve a 95% success rate, and that's just because cataracts have been around for so long that the medical field has had such great opportunity to develop and create new developing surgery methods. So the success rate is extremely high and the recovery rate is extremely quick as well. And the cons for this are just typical cons for any surgery. It would be swelling, bleeding, irritation, maybe infection if it's not properly taken care of. But overall, the recovery rate is significantly quick in comparison to other surgeries. Now I will be talking about the medical advancements made surrounding cataracts. Cataracts have been around for so long. So as I stated, they've had that opportunity to grow and develop with the world. So the first new medical advancement is new equipment that has been made and developed to allow for more accurate measurements. These measurements are extremely important because they indicate where the markings should be made for the procedure to actually happen. So that first incision is typically small, but with these new medical advancements, they are allowing it to be made smaller and allow a quicker recovery rate because of that smaller incision. Another improvement is the lens replacement. So as I mentioned, surgery is the treatment for this. And after the removal of your lens during the surgery, they do have to replace it with a brand new one. And this new lens is called an intracellular lens, IOL. The new advancements being made with them involve the two different types. The first being monofocular, and that focuses around improved distance vision. So that significantly allows you to see at farther lengths. The second is multifocal, and a multifocal intracellular lens allows you to see near and immediate things better and also improves your distance vision. With these two new medical advancements, it has allowed cataract surgeries to continue to stay at such a high success rate and to continue that recovery rate being so high. Now I will be sharing with you guys the interview that I had, and I had it with my grandfather who had cataracts for 2 years. The first thing I asked was, how long did you know you had cataracts for? He said that he had had them for around 2 years before he had fully addressed them and realized that he had them. He didn't pay much attention to them because his symptoms weren't as noticeable. I had asked him what his symptoms were, and he mentioned double vision, light sensitivity, and trouble seeing at night. As these symptoms worsened, they prompted him to want to get them looked at. I then asked what it was like to live with cataracts, and he said it didn't affect him much in the beginning due to him not noticing, but later on, as his symptoms progressed, his vision significantly decreased, and that resulted in him needing to get the surgery to get them removed in both of his eyes. I asked what treatment he had, and as I mentioned, he had surgery. He had phacoemulsification surgery that was done in both eyes. So a small incision was made to remove the old and replace it with the new IOL. He had mentioned that it was his first surgery and that the recovery rate was extremely quick. I then had asked how his family supported him throughout the process, and he said his family was extremely supportive. And since the surgery was done on his eye and you have to go in one at a time to get them done, he was unable to drive. So his son had helped him drive to and from the appointments each time. And that was his experience with cataracts. And that's why we're excited.